Hey, I'm Gordon Ramsey. I'm the Wichita Police Chief. Thanks for joining us today. We're here to talk about Sexual Assault Awareness Month, and I have two guests with me today, Detective Melissa Burns from our Sexual Assault Unit, and Megan from Wesley. You guys want to say hello and tell everybody a little bit about yourselves and what you do?
I'm Melissa Burns. I'm a detective with the Domestic Violence and Sexual Assault Unit. I've currently been a detective for about 2 years, and my primary focus in our unit is working sexual assault cases.
Great.
I'm Megan Meyer. I'm one of the forensic nurses at Wesley Medical Center, and we specialize in caring for victims and or perpetrators of violence, both intentional and unintentional.
Well, let's talk a little bit about sex assault kits. So we had a number of untested kits up to 2016, and Melissa, as you know, we got involved with the SAKI testing initiative, and in 2016 we began sending all of our kits to the state. As of 2018, we have no untested kits, and we continue to send those kits in regularly. Do you want to talk a little bit about your role and how you see things going in that regard?
Sure, absolutely. So, like you said, we did participate in the Sexual Assault Evidence Collection Kit initiative. And as part of that initiative, what it does is that it makes sure that all sexual assault kits are sent off for testing, regardless of whether or not a suspect is in custody, whether or not the victim wants to pursue charges. All of those get sent off and tested 100%. So as part of that process, what we do is that we collect all of the kits that our Property and Evidence section currently has. Part of that can be from actual rape investigations. That can also be from reports where a victim has submitted to a sexual assault kit and they're not for sure if they were sexually assaulted. A lot of times those can mean that the victim was under the influence of something at the time, and so they're not certain. Those also get sent off. And what we do with those is that we send off the entire kit to the Kansas Bureau of Investigation, to their lab to be tested. Or some of those also get sent off to our local Sedgwick County Regional Forensic Science Center for testing.
Megan, so when a survivor comes into the hospital for the exam, what choices do they have when they're there with you?
So when a survivor comes into the hospital and we present them with all their options, it is definitely a patient-guided exam. They are not required to do all parts of the exam, and no matter the age, whether or not it's a reported a kit or whether or not it's an anonymous kit, they can choose to do any or all parts of the exam or nothing at all. Nobody is forced to do anything. Law enforcement can't force a survivor to get an exam done. Parents can't force anybody to get an exam done. It's all based on what you want to do and how you want the exam process to go. And we like to give that control back to the survivors, so that way they're in control of how things go. And we give them all the information, and we encourage them to speak up. If they don't feel comfortable with some parts of the exam, then they just need to let us know, and we're okay with that.
Can a victim come in and not have police involvement?
Reporting to law enforcement is not always, everybody's, first response to be able to think about like what they want to do. Maybe it's not safe for them to report at that time, or they have a lot going on and they just are overwhelmed by the process. So it does give adults that time to think about it. We do not have that process for minors, though.
A question that I've heard asked before is, anytime someone goes into the hospital, they think, boy, insurance, how do I pay for this? Does that come up, and how do we handle those situations?
It does come up. So as far as the kit goes, the kit is charged to the county that the assault happened in. So we submit those charges for that kit, but we do have crime victims compensation as well to be able to help out with any charges that accrued during the time that they were involved in the process of that.
It's a stressful situation, and to think about, some of the other factors that you hear about, we appreciate you sharing that insight with us. Melissa, we've worked hard to improve our response to sexual assault. What are some things that we've done at the PD and that you've been involved with that you're proud of that, people should know?
As a whole, we're always working to improve our response to various crimes. Sexual assault in particular is a very special crime. There's a lot of moving parts in those investigations. As part of that, we've also recognized that the majority of sexual assaults are perpetrated by someone known to or associated with the victim. A lot of times what we've seen is that these crimes are committed in a domestic violence realm, a domestic violence aspect. And so as part of that, we've really bumped up our efforts to investigate and hold accountable offenders of domestic violence. In 2020, we started the Domestic Intervention and Violence Reduction Team. And basically the goal of this unit is to hold domestic violence offenders accountable. So they're actively going out and looking for offenders who have pickups or warrants in reference to domestic violence cases. Part of that also that we started is that we began a strangulation awareness initiative. And essentially how that started is that we noticed that a lot of survivors who go through a strangulation incident don't understand the potential dangers and risks involved with the side effects of having been strangled. So in order to bring awareness to those survivors, what we did is that we came up with pamphlets in both English and Spanish to help survivors recognize those signs and symptoms of having been strangled, and to help them understand when it's time for them to report to the hospital and seek medical attention, and also to help them document their own injuries. Also, another part of that is that we came up with a website to help survivors understand that this is a larger issue, and that there are options. There are various community programs. And another thing that we've done is that we have sought out education in our realm of, as far as investigating sexual assaults within the LGBTQ community and in regards to male sexual assaults as well. We're always looking for educational opportunities to better our own investigations in reference to sexual assaults.
And we also work very closely with the advocacy agencies as well as our partners at the hospitals. You want to talk a little bit about how we coordinate our response between our advocates in the hospital and the detectives?
Generally, we work with Wichita Area Sexual Assault Center. And so when we get notified about a potential patient that we have that could be a victim of sexual assault, and you'll hear us use victim and survivor interchangeably in that. And so when we usually get that call, our next call is to Wichita Area Sexual Assault Center. Before COVID happened, we would have an advocate meet us at the hospital, and they sometimes would be there with the patient before we even get there. So they're able to kind of be that resource for them as far as where to go from there, having a hand to hold, just being a good support system for them. They are also available there to answer any questions that go above and beyond, where do I go from here? And we try to, reinforce that the survivors are not going to have to be alone throughout the process of, they choose to go through the advocacy route. They have, a lot of resources outside of the services of the hospital where they can have support groups, counseling, and all of the services are 100% free. They have a 24/7 crisis line just in case that they don't, cope with it well and wanted somebody to talk to anytime during the day or night.
So if they wanted someone else there, an advocate or family member, that's acceptable?
Absolutely.
Melissa, from your perspective, how is the relationship and, how do you guys work together to ensure that we do the most for our victims?
So in all honesty, working in corroboration with all of our community partners really impacts the effects of the investigation. What we typically see is that when a survivor has a positive experience with the sexual assault nurse, with the responding officer, with the detective, the investigation as a whole is much better and is a much more solid case because that victim is very trusting, they're more forthcoming with information, and we typically see them follow through on the investigative process as well, going to court and things such as that nature. And so it's just vital that we work in partnership with all of our community partners.